My name is Dr. Andrea Culliford. I'm a gastroenterologist and liver disease specialist at the medical offices of Manhattan. I came here in January of 2020 after 15 years in the Bronx at a community-based hospital where I was the chief of GI for 10 of those years. I'm truly excited to be here at medical offices of Manhattan because gastroenterology is my passion and I love taking care of patients. So a colonoscopy also entails using a colonoscope, a video scope that's attached to a light camera, and we can see on a television monitor what is going on as we traverse your colon. Everyone has about 3 to 5 feet of colon. We enter the rectum with the camera, and we go all the way to the right colon and the part of your colon that's called a cecum. This typically takes about 3 to 6 minutes to get to the right colon, and then we come back at a rate of about 7 minutes total. What do we see? We look for polyps, which can be precancerous. Typically, they can look like little pieces of broccoli in the colon. If we see one, we remove it. We can remove it with a biopsy forceps or with something called a hot snare or a cold snare. And then as we're coming out, we also can see different things like diverticulum, which are small pockets in the colon. Typically, we see them in patients over the age of 50. They are benign, and there's nothing that we need to do for them. And then we can also see if the patient has hemorrhoids or if they're exacerbated and enlarged and something needs to be done about them. So after you've been on the liquid diet, you also take a special colon cleanse, and that may be whatever your doctor prescribes or recommends for you. Typically, it causes you to have to use the bathroom and have about 10 to 15 bowel movements the night before. Then you have nothing after midnight, fall asleep, and then the next morning you typically come here to the office. We have a state-of-the-art endoscopy suite. We have a board-certified anesthesiologist. You'll check in, you'll talk to the anesthesiologist. He goes over what to expect. You are asleep for the procedure. Typically it lasts less than 15 minutes. An IV is placed. That's really the only discomfort that you have that morning. And then we do the scope. Once the colonoscopy is finished, the patient is wheeled to the recovery area where they remain for about 15 to 30 minutes. The patient can pass some air. They may feel like they have to use the restroom, which they can do. They are monitored. Their blood pressure, heart rate, and oxygenation is still monitored. And then when this process is finished and they're awake and alert, they can get dressed, have a quick snack, and be on their way. So after the colonoscopy, we typically get your pathology back in 7 to 10 days. Typically, we call you on the phone and go over whether or not your polyp was benign and when to repeat your colonoscopy. If you have other pathology, such as inflammatory bowel disease, that typically requires a follow-up visit where we go over the pathology, the diagnosis, and how to treat it so that you feel at your best. So what are the risks of a colonoscopy? Because there are other mechanisms of doing screening for colon cancer. The risks are very low, less than 1%, chance of an infection at the IV site, chance of bleeding, or chance of making a small tear in the colon called a perforation that may or may not require surgery. These risks are low, usually less than 1%, and we don't anticipate that happening. Overall, the benefit of a colonoscopy far outweighs the risks.